tuning in now. We're here on Revive Life speaking about how to prevent cancer. Nature certainly has her wisdom, and in the fact, phytonutrients, luteolin, apigenin, myrcene, found in foods such as mint, thyme, and parsley, have a similar ability to halt cancer growth as one of the common chemotherapeutic drugs, Gleevec, in lab settings. They're especially effective when used in combination. To boost your body's immunity, add daily exercise to stimulate the lymphatic system, which contains fluid primarily made of white blood cells to support immune function and the removal of toxins from your body. Our next guests are from the Ottawa Integrative Cancer Centre, the first integrative cancer centre in Eastern Canada. Executive Director and founder, naturopathic Dr. Dugald Seely, who also serves as the Director of Research and Clinical Epidemiology at the Canadian College of Naturopathic Medicine, affiliate investigator for the Ottawa Hospital Research Institute, and peer reviewer for Health Canada's Adverse Reaction newsletter. Our complimentary guest was 58 when she was diagnosed with stage 3 breast cancer in the summer of 2009. She was in the throes of trying to get on track with a treatment plan when she heard about an oncological naturopath, Dr. Lisa Kirschner. With a customized plan to build up her immune system and lessen the effects of chemotherapy, she is thrilled to have had no evidence now remaining in her body of cancer. She continues to work with the OICC team. We are also pleased to be joined by cancer survivor Tamara Levine. So welcome. Thank you so much for joining both of us.
Thank you.
Coming to the studio. Tamara, I think through our audience's eyes, some of us really don't understand what it actually feels like when you actually have that diagnosis. What are the thoughts that go through your mind?
It's a very, very scary time to find out that you have a cancer diagnosis. There's, of course, the build-up to the diagnosis. In my case, I found a lump in my underarm in the shower one day out of the blue. I had had a clear mammogram 10 months before, so I didn't even associate it with the possibility of breast cancer. But I saw my doctor right away and had a series of tests and then got the diagnosis. It was a time of despair. I knew it was a very aggressive cancer, and I didn't have a treatment plan yet. And so I didn't know what my chances of survival were. I didn't know what my life would look like over the next months or years. I didn't know whether I'd make it at the other end. I was working full time. I had a family. What happens to my life as I've known it? So it's a very, very dark time. I call it the black hole sometimes.
Yeah, I think people have commonly described it as that. But in terms of resources, you found out about the OICC, and tell us how your experience was. What was important about using complementary care?
Well, I was in the process of getting on track with mainstream oncology at the hospital. When I found out about Dr. Lisa Kirschner, the naturopath who had specialized training in cancer care. And I figured that I needed to do everything I possibly could to fight this aggressive cancer that was now in my body, which I had always thought of as healthy and resilient, and now what was going on. So there was the mainstream cancer care, there was the naturopathy, and there was what I could do to fight the cancer. Working with my naturopath gave me the opportunity to learn about all kinds of supplements that I could take that would both fight the cancer as well as make it not quite as horrible to go through standard treatment and to...
Some of the side effects of the chemotherapy.
Some of the side effects of chemotherapy, which can be pretty brutal. And while chemotherapy was still a rough road, I know that my experience was not nearly as bad as it is for a lot of other cancer patients, and I thank my naturopath for helping me through that.
Dr. Seely, tell us about the OICC.
Well, we are a center dedicated to providing complementary therapies and a whole person approach to care that certainly includes naturopathic medicine and also includes other kinds of modalities that are complementary, non-conventional type therapies, and with the goal of providing this in a safe and effective way that tries to I guess, provide more balance and a more of a holistic approach to care beyond what can be provided in the hospital. So naturopathic medicine is one of the core therapies there for sure, and Dr. Kirshner has joined us. We're delighted to have her join us. She's got a great experience in that area. We've got a physiotherapist that's got a focus on cancer care, an acupuncturist. We've got an osteopathic doctor that we're going to be bringing on. So there's a number of different therapies. Again, it's to nourish and support the person through the process of the disease and fighting it off and supporting the body to be able to cope better and to fight off the disease, as well as to be able to support the people going through the process of the therapy and some of the side effects that people experience during chemotherapy and radiation.
I think during that time, a person may be very fatigued and overwhelmed. So to have all those services in one location where your care could be integrated would really be a bonus.
Yeah, I think, you know, one of the things that the people living with cancer, they're very motivated to look at other options and to do as much as they can for themselves. The reality is that the current system, it doesn't really integrate with complementary therapies effectively, and what we're trying to do is to help improve communication links between practitioners so that people who are living with cancer feel that they're cared for in a whole way and not in different sort of silos is one of the issues there. So trying to improve communication, which only improves safety and creates a lot less anxiety from the patient's perspective.
And I think it's important to note the difference between alternative versus complementary. What would your comments be?
Yeah, thank you for making that point. Definitely, we're not about providing an alternative or instead of kind of therapy, but really more complementary and ideally integrative, so that there's this linkage, and it's again not something instead of.
And it's very evidence-based. It's a non-for-profit organization. Do people need a referral?
People do not need a referral. They can come to the clinic themselves. There's no need for a referral, absolutely, yeah.
So with all the difficulties that you have been through, Tamara, what was the one gift in the whole experience? Because often life gives us these challenges, and in the end, we come out better than ever.
I think that's true. That you know, when I was first diagnosed, a friend who had gone through breast cancer several years before said, "You won't believe me now, but there will be gifts." And I remember saying, "What gifts? What are you talking about?" Because I was in the depths of despair at that point. But I think she was right. Mm-hmm. There truly are gifts. I think when we face our mortality, and when we have to wrestle with the prospect of not making it, we sometimes get to a point where life becomes ever more precious. Mm-hmm. And so carpe diem, seize the day, becomes the mantra of how we choose to live. I think we know in a different way what's important.
Thank you for that. You certainly are an inspiration to anybody going through the process. And again, we are really happy to say that you are a cancer survivor and that you're doing really well. So thank you. We're coming back with more with Dr. Seely, and thank you, Tamara, for sharing your story. Another cancer-preventing consideration is detoxification. The liver is one of the main organs in this process, and when it is congested, stress in the body increases and immunity and energy reduces. The amount of chemicals and toxins that we use annually can be lined up and cover the distance from the northern tip of Canada all the way to the southern United States. We'll be back shortly after the break to answer more questions.